teachers and my dear friends. My name is Rahul Dilan. I am first year MBBS student. Today I am going to present a topic called erythropoiesis. Let's discuss about the definition. What is erythropoiesis? Erythropoiesis is the process by which red blood cells are produced in bone marrow. The process takes around 7 to 10 days to form mature red blood cell. Red blood cells have a lifespan of about 120 days. Nearly 2 million RBCs are destroyed and replaced every day. The main function of erythropoiesis is to maintain adequate oxygen transport in the body. Now let's discuss about the sites of erythropoiesis. Sites of erythropoiesis. Changes with age. During embryonic life, RBC are first produced in the yolk sac, then in the liver and the spleen. After birth, erythropoiesis occur in all bones up to the age of 20. After 20 years of age, it is mainly restricted to membranous bones such as vertebrae, sternum, ribs, and pelvis. Stem cells hierarchy. Erythropoiesis starts from hematopoietic stem cells, which are multipotent. These differentiated into the common myeloid progenitor, then megakaryocyte erythroid progenitor. Further differentiated into leads to BFEU and CFUE, which are committed erythroid progenitors, and finally form red blood cells. Stages of RBC maturation. First stage is normoblast, or called proerythroblast, which has a large nucleus and basophilic cytoplasm. This is followed by early normoblast, where nuclei disappear and chromatin condensation begins. In intermediate normoblast, hemoglobin synthesizes starts, and the last cytoplasm becomes polychromic. The late normoblast has a pionotic nucleus with increased hemoglobin content. Final stages. After late normoblast, the nucleus is expelled and forming a reticulocyte. Reticulocytes still contain residual RNA and are seen in bone marrow and peripheral blood. Within 24 to 48 hours, reticulocytes mature into erythrocytes, which are fully functional RBCs. Now let's discuss about the erythropoietin hormone. Erythropoietin is a glycoprotein hormone mainly produced by the kidneys. Its secretion is stimulated by hypoxia or low oxygen levels in the blood. Erythropoietin acts on erythroid progenitor cells and prevents apoptosis while promoting their survival and proliferation. Now let's discuss about the erythropoietin receptors. Erythropoietin receptor signaling. Erythropoietin binds to the erythropoietin receptors on erythrocyte cells. These activate signaling pathways such as JAK-STAT, PI3K, and MAPK pathway. These pathways help in cell survival, proliferation, differentiation, and hemoglobin synthesis. Now let's discuss about the regulation of erythropoiesis. Erythropoiesis can be regulated in two ways. Basal erythropoiesis maintains normal RBC level under normal conditions. Stress erythropoiesis occurs during conditions like bleeding, anemia, or hyperoxia, where high levels of erythropoietin increase the RBC production. Requirements for RBC production. Proper erythropoiesis requires iron for hemoglobin synthesis, B12 and folate for DNA synthesis, and heme formation. Deficiency of this nutrient can lead to different types of anemia. Normal RBC values. In adult male, normal hemoglobin ranges from 13.5 to 17.5 grams per deciliter. In adult females, it ranges from 12 to 15.5 grams per deciliter. The normal reticulocyte count is around 0.5 to 2%. Now let's discuss about the disorders of erythropoiesis. Disorders of erythropoiesis include anemia, where RBC production is reduced, and polycythemia, where RBC production is increased. Other disorders include thalassemia, which involves defective hemoglobin synthesis, and aplastic anemia, where the bone marrow fails to produce blood cells. To summarize this all, Erythropoiesis is a continuous and regulated process controlled mainly by erythropoietin. It takes about 7 to 10 days to produce mature RBC. This process is essential for oxygen transport and requires iron, vitamin B12, and folate and heme. Thank you for your kind patience and attention. I would be happy to answer your any questions.